in Patient Hub, formerly known as Aspen Breast. It's time to get started. It's the top of the hour. We got a lot to cover, so I just want to go through a couple of housekeeping things real quickly. Chrome or Edge work best. Internet Explorer does not work well with Teams, and that's what we're using today. Please mute and stay muted for the whole presentation. It is so distracting if you're not muted, and I appreciate that. Any questions that you have along the way, just put them in the chat and we'll answer them either by email or a phone call. Probably won't have time because we have so much to go over and it's only 30 minutes. Anybody that is in a group and you're signing in together, please be sure to send your a list of all the people that are with you and put it in the chat, or you can email it to me, either one. Probably chat is easier. And please be sure that you attend through the entire presentation to get your credit. We're recording this, but it's mainly for attendance and questions only. Okay, the name of this Lunch and Learn is Tracking and Resolving Outstanding Issues Using Patient Hub. My name is Becky Testerink. I am part of the customer success team here at Valpara Health. And with that being said, I wanted to talk a little bit about the customer success team and how important it is that you know us. We are here to help. The customer success team is here for you to help with anything that you need in your system. If you have any questions about what we do, we can help you with workflow, with your work lists, with your statistical reports, anytime you're getting ready for inspections, your audits, your exports, all that stuff. You can count on us to help you for that. Now, there's a lot of hidden gems in the Valpara Health software, so please reach out to us. If you do not know who your customer success team person is, just send an email to support or to me or call in and we will get you hooked up. Okay, just for grins, they actually want us to talk about objectives for these. So at the end of this presentation, you should be able to compile a list and send the patient communication for routine follow-up reminders, generate a letter to the patients and their healthcare provider when a problem has not been resolved, set the correct parameters and run the report to identify patients that have been recommended for further evaluation, understand the need to have daily and weekly patient statistical data for follow-up, apply notes to the patient history for pertinent information and problem solving, correctly follow pathology results for biopsy patients, and create and set parameters and reports for patient tracking and problem resolution. So, Patient Hub. We're going to talk about the reminders, and basically what that is, that's communications with your patient. And Patient Hub, Aspen Breast, the notifications can be automatically sent either by stamped mail or email for all patients, screening, diagnostic, and procedures. Your Birad Zero, we're going to talk about that. That's your immediate follow-ups, lists of latest reports, patients who have not returned and how to contact them, and alerting your healthcare provider automatically, their healthcare provider, excuse me. BIRADS 4 and 5, that's alerting the healthcare provider that their patient has a suspicious abnormality. This is how we make sure every patient is returning for the recommended next step, screening, additional imaging, biopsy. We will look at all of these and even how cases are resolved. So we're going to start out with the reminders, and we're going to look at the letters, the routine follow-up, the short-term follow-ups, the problem case letters, and then we're going to look at some lists that might give you some good information about the patients who needed to be reminded and haven't shown up. So first off, let's look at how to set up the reminders. So in my picture here, this is my, I've opened our Volpara Patient Hub page. You go to your records. I've circled it in red. You click on that records and it will give you a drop down and you choose the site settings, and you can see below all the site names. You double click on your site setting, and then you will get this list. These are your site settings. Well, what we're going to be talking about today is the patient reminder letters. So if you go a little over halfway down, you can see the little red asterisk, and it says patient reminder letters. Under that, we have the routine, the short term, the problem case to the clinician, and the problem case to the patient. So first of all, the very first thing you come to when you open that up is, how do you want to send the communication? Do you want to communicate with the patient by printing a letter and sending it stamped mail, or do you want to email it? And if you haven't ever considered the email, I wish you would, and we're happy to talk about that. But it's economical, it's eco-friendly. Most everyone now has an email address, especially the past year we've had. People are more and more electronically savvy because they were kind of forced to be. So, it might be time to start looking hard at emailing rather than stamped mail to your patients. Patients that don't have an email address in Patient Hub will automatically get into a queue. If you are selecting email and they don't have an email address in, then it will automatically be queued up to be sent stamped mail. That's the same thing with a patient that has an address that bounces back, that's in there wrong, or it's closed or changed, then they will automatically be put in the queue for a stamped letter. I want to show you a couple of advantages of email. So if you see here, this is what we're going to do now. Routine reminders are your screening patient reminders. And we are still in the site settings here, exactly the same place, and under that records, under your sites, in a site setting. Next, you're going to look at when the reminders are going to be sent. So you can see here, you can decide whether you want to send them or not. This checkbox can be checked or unchecked depending on whether you want to send them or not. Most places do. You select your printer, and then that next line is, how many times do you want to send a reminder letter? The next line shows the initial letter when you want it to be sent, how many days either before they're due or after they're due. And then that third line gives you the option of second and third and fourth letters if the patient does not show up and Patient Hub does not recognize that they've had their screening mammogram. When the patients had their screening mammogram, they are taken off of this email and letter list. They don't get any more communications. They won't need it because they've been there. The next box within that site settings is your short-term reminders. And again, you can send these or not. And it's kind of the same way. How many times do you want to send this? And this one is, how many times before they're due do you want to put that, send that email or that letter? And then you can send as many as you want to following it, up to 3. So, problem case reminders to the patient are generated when there's been a recommendation in a report for a problem that needs a resolution. For example, additional imaging. You can set when to send the letter, how long after the date of the procedure, and how many times the letter if Patient Hub does not see the procedure that was recommended. Again, if the procedure's already been done, that communication is not going to be sent. I will tell you too, talking about email, the facility where I get my mammogram, emails my reminder letters and my result letters. And the first time I get that email, I think, oh, yeah, it's time to schedule. And then it kind of leaves my mind. So that second one that comes in, that's the one that really makes me say, okay, you forgot it, get on the phone and call and make your appointment. So these are here. This is the problem case letters, which are a lot like the letters to the patient, but they're to the healthcare provider. The problem case reminder to the healthcare provider are a little different. They include a form for each patient, so it's easy for them to respond. You can, again, set when and how many times you want to send this reminder to the healthcare physician in the settings, just like the other patient reminders. These are all in the same place under that site setting. So here's an example of the letter. You can word it the way you want. Down at the bottom, it gives a list of the patient, her date of birth, and what was recommended and when. And then they can just quickly fill out this problem case letter and sending it back very easily. And again, you can send this either stamped mail or you can email this to them. Either one. You can set that up for the healthcare providers problem case letter also. So then let's talk about the list. These are the lists that are in Patient Hub Statistical Reports. Patients due and overdue for follow-up and the exam list. Let's dig into that a little deeper. So here, and if you remember, the last Lunch and Learn we did was about statistical reports. And we had, I told you, remember this yellow box. Every time you open your statistical reports, every one you open is going to give you some information about what this report's all about, what it's going to show you, and the information that you're going to get. Some of them are self-explanatory, just like this one, a list of patients who are due and overdue for follow-up. And this report shows the routine and short-term follow-up patients. These are the screening mammograms that are due and overdue. It's been extremely important during the shutdown when there were times when there was nobody there to send reminders to these patients. And when we finally opened back up, you could go back and see who had gotten a letter and who hadn't. And you were able to go in and send these letters to the patient. Um, um, Sites that have also been using a printed call list for these patients and setting a reminder. The list can be sorted by date, site, referring healthcare provider. You can do either short-term follow-up or and be ordered by date or alphabetically by the patient. I think most people do it by date because you want the oldest one to show up first. So let's drill this down a little bit, and you can see this might be a list. So you see this patient's, what their reminder date was, and these are funky because this is my system. It's not hooked up to a live system. But you see these reminder dates that are here down at the bottom for this next patient, Miss Connor. And you can see that her address and who her healthcare provider is, and then the reminder date. Now, on Miss Henson, the next one, you can see her ID, patient ID number, and then it's her phone number. And Miss Connor didn't have one. So when you print this list, I put this in here on purpose because you can take that first one, that Miss Connor, and you can see they don't have a phone number for her if somebody is calling, but you can call her healthcare provider. It's right there. You can call their number and try to find a good number for her. So this is a really helpful list. Many sites print this list and have a scheduler or a tech assistant, or if you're in a facility where everything falls on you, this is a great list for you to be able to pick up and call your patients. that's something that you guys do. So the exam list. This is another statistical report. Um, and there's a lot of search criteria within the exam list. You can select all or some of these filters. I've got this collapsed so that I can show you all of the different filters that you can select. Again, note the yellow box. Display a list of exams. So let's move on from that. So you can see here, again, inside the procedure category, which is where I was going to live, I want to see all my imaging patients for a certain criteria. And you can see right next to each one of these categories, there's a small white arrow. You click on that arrow, and this next box is this imaging box, and you can see all of the imaging procedures. It's just drilling down more and more what you actually want your exam list to show. Filtering your search for whatever you want to see. In the exam list, I opened up the recommendation categories. You can choose whatever recommendations you want, again, to specifically look at a certain list of patients. And here is the criteria that I've got. This list shows the patients and their exam done and what is still outstanding. So you can see along with the patient ID and dates and exams leading up to the recommendation, all of that is shown under this patient's name. The selection criteria is open, and you can limit the report to whatever you need. Again, right here you can see Miss Bryant on 4/26/21. She needed repeat images. And that's where she is. That's where she is in her care. The next one was a screening mammogram, and she needed additional imaging evaluation. All these patients are going to be listed and what is outstanding. It's just another way of keeping track of who's not getting or who hasn't come back for whatever their recommendation was. So that's our reminders. And let's move on now. I want to talk a little bit about the Birad Zeros. And these are the recommendations that we need to pay attention to for immediate attention. These are the ways to follow up on these Birad Zeros cases. So unresolved problem case list. And it's one of the things that we've used most, probably, because here's our yellow box. Because these are all the recommendations for patients without resolution, and you can specify the date, this report can be used daily to identify the patients that need additional workup and as a navigation tracking tool. So what we're going to talk about today is the ones that we want daily zeros, all of our zeros. So daily, you might want to look at the Birad Zero with the recommendations for additional imaging, repeat images, or obtain priors. And we'll talk about the Birads 4s and 5s next, but this is some of the ways you can search options within the report. It's one of the most used statistical reports because it shows the immediate attention patients. These are the patients who we cannot let fall through the cracks. We have to follow them very closely. So again, I'm just showing you in the unresolved problem case list. You can see here that you can choose any of these assessments or any of the problem types to filter your report. And this is kind of what it looks like. So these patients are this top one, Miss Craig. She was recommended for an excisional biopsy following a core. So it may have been something like a high-risk lesion came back on her pathology. The next one, Miss Ruth Tester, she was recommended for diagnostic bilateral mammogram following a screening mammogram. And then this next one, Miss Bryant, repeat images from a screening mammogram on the left side. So all of these are ones that we want to pay attention to, that they've had their screening mammogram, they've come in and they're being recalled for some reason. You can take this list again and you can call the patient right from this list. You can see the phone numbers and their healthcare provider phone numbers. I'm going to show you a note down here in the bottom in Miss Bryant. That is when you, and we're going to talk about notes a little bit in a minute, but what I want you to see is when you make a note on the patient, it's going to show up on this unresolved problem case list. When you enter that note in the patient event, it's going to show up on this list. So for example, the patient came in for a screening and leaves the country for 3 months, and it does happen. And she needs additional imaging. So you can put a note in here to reflect what's going on with that patient, that you talked to the doctor who you spoke with in their office, and what the next step needs to be taken, if it's a date or when she's going to return, anything that needs to be noted on this patient that you're looking for her to do repeat images on. And when anybody opens up this report or even opens up that patient exam, that note is there and everybody knows what's going on. And you're not just like, oh my gosh, where's this patient? Why aren't we done this? This note will be there to tell everybody where she is in her care. So BIRADS 4s and 5s, again, we're going to look at the unresolved problem case list. These are the suspicious findings, the patients with suspicious findings on their mammograms or their imaging, breast imaging. And these are the ones who we have to closely monitor. And generally, these are the patients who've been recommended for a biopsy. So again, daily, you look in your unresolved problem case list, and again, here you see this one's recommended for a needle biopsy. And then the next one down here is, again, that core biopsy. The pathology was probably malignant, and she's been recommended for a surgical consult. So again, these are where the patients are in their care, and so you know the next steps that you need to take with them and any follow-up that needs to be done. Pathology. I'm going to talk about that real quickly. How we follow the pathology. How do we know when it's been done and what's been done? So when the biopsy procedure has been dictated and read, and the pathology pending has been selected within the report, this is how it will show up on the unresolved problem case list. So this patient had a core biopsy, and we're still waiting for pathology. So these patients, again, don't fall through the cracks. You know where to find them. You know you can run this report, and anybody who is outstanding, when you put these parameters in, I want to see who's waiting for pathology, this will show up on your unresolved problem case list. Okay, pathology. There's a couple of statistical reports for pathology also. Pathology results list. Here's our yellow box, list pathology procedure results. So you can fit in any date range that you want, and you can see all of the patients that you see their name and their patient ID and their date of birth, their procedure date, what procedure was done, the right core biopsy on this Miss Abbott, and then what the recommendation was. So all of these are done right here. So this one, that first one doesn't have a result, but look at Miss Abbott underneath. Core biopsy, right. Screening, well, that's crazy that you wouldn't do that. But it was a benign pathology. On this Gary, it's high risk, and Atkinson is benign. All of these, to your date range, you can show a report of all of the pathology results for your site, for your system, in your date range. So then another report is the pathology code results profile. It's a list of patients with pathology results for each pathology code. It's really an interesting report. You can see, again, you can put in for a date range, and you can see all of the malignant pathology codes that were found in that date range, and you can see the patient's name under each one. All the benign, and then you'd have all the high risk also. So you have the patient name and their ID number and the date that it was done. A little bit of information, good information that you have following your pathology results. So quickly, let's talk about notes. Hugely important when you're communicating where the patient is in their care. There are 3 ways to enter notes in Patient Hub. I want to also look at how you can use a note to resolve an issue and when you might do that. So the first note is a note on the patient page. Um, this is the note that would appear in the patient event list, the one that I showed you that showed up on the unresolved problem case list. The notepad icon at the top of the page inside the patient data, in that picture icon is you click on that, and it brings you up this note resolve box on the patient when you have that patient open. So within that box, you can see the patient refused care if you want to click that box. But what I'm concerned about with this one is you can put anything in this note here and save it, and it appears just like it does below on the patient event list. So the date, it says note, and then any note that needs to be added to her history. So those are things that when you save it, that's there, and you will see it forever and ever on the patient event list. Another way is in the patient page, in the patient exam page. You can see this patient here under the clinical staff. You see the comments. That's a place to put a note in there. You have the option to put multiple notes. You can choose a note to go on the report just by checking that box. It says appears on report. At the end, you see this little white arrow. You can set up, that's a text key that something you would use often, and then you don't have to type it in every time. So you as technologists can fill that out and set that up. So if a patient had could not lift her arm, or patient was in a cast for this mammogram or something, but this note pertains to this particular exam. It doesn't show up anywhere else except on this particular exam. So this note is pertaining to this screening mammogram. And then we have on this note, the sticky note, and that sticky note was designed exactly for what it sounds like, a sticky note that can be used just like we used to use sticky notes on the folders and on the jackets. When it is thrown away, it is thrown away and cannot be retrieved. It appears at the top of the patient exam list, and you can see up here almost to the end on the right side of her icon list there, sticky note. You just click on that and you can type in anything that you want, and it appears on the patient's events or actually on their page until you throw it away. Note resolve. And any unresolved issue can be resolved in a note. Patient refused care can be checked if that's what it is, and any note added to show why they refused care or any notes that need to be put in there. And you can see here, I opened this one up, this core biopsy, waiting for surgical consult. It could be additional views. It could be a biopsy was recommended, and you can see down at the bottom there. But you can resolve this if you click on that procedure right there beside the date, the event date, that there's a white box. You can click on that and that will resolve this, and we were no longer tracking. I want to caution you not to use this unless this patient is lost to follow-up, because you don't want to resolve something in here because they will automatically show loss to follow-up in your audit, because this is just saying the patient did not come back for whatever reason. Outside studies need to be added as an outside procedure, and then the information entered. That way the audit will pick it up. Self-referred patients, this is just a reminder. If you do not do self-referred patients, which I don't think most people do anymore, there are a few sites that do, but you can check your patient list in your statistical reports and go down and choose that self-referred, and then you make sure that there's nobody on this list. So if you have somebody on a list like this, they need to be investigated to see why you didn't have, why they didn't have a referring physician. Okay, that was really fast and furious. It is 2:30. Respectful of your time. Again, any questions in the chat will be answered by email or a phone call. If you want to know something more about this um, um, Lunch and Learn or any of the others, we're happy to discuss any of the points in this presentation further. Just email us, email me, email support. We're happy to do it. Our next Lunch and Learn for Patient Hub, the fourth and final one, will be in July. Thank you so much for joining us today. We will get your certificates out to you very soon.